All right, I think we can get started. So welcome everyone. HOSA is delighted to be partnering with the Healthcare Information Management and Systems Society, also known as HIMSS, for tonight's webinar From Classroom to Career, Health Information Pathways for Students and Advisors. We want our listeners to be aware that everyone in attendance tonight is muted. If you have a question, please use the Q&A feature. This webinar is being recorded and will be shared with you via email after the session. I'm Nick Ballard. I'm privileged to serve HOSA-Future Health Professionals this year as International President, and I'm honored to introduce our speakers from HIMSS here tonight. Dr. Katie Kerr is an Associate Professor and the Director of the Masters in Health Information Management Program in the Department of Health Informatics and Information Management at the College of St. Scholastica in Duluth, Minnesota. She's also the chair of the HIMSS Emerging Healthcare Leaders Task Force. We're also joined by Brooke Palke, Doctor of Education, Certified Professional in Healthcare Information and Management Systems, Registered Health Information Administrator, and Fellow of the American Health Information Management Association. She serves as the chair of the Health Science and Technology Department at Charter Oak State College out of New Britain, Connecticut. Dr. Palke is also the program director of the Masters in Health Informatics and Masters in Healthcare Administration programs, and she has a teaching focus on clinical classifications and data standards, health informatics, assessing healthcare quality, and corporate compliance. Christina Aldridge, MD, PhD, and Fellow of the American Medical Health Informatics Association, is the Director of Health Informatics Programs at the University of South Florida School of Information. Dr. Aldridge also holds an adjunct professor position at USF Health Morsani School of Medicine, where she teaches graduate level courses in health informatics and participates in medical student education. She began her career as a family physician in the U.S. Navy, where she used the earliest forms of electronic medical records to manage her patient panel. And finally, Dr. Courtney Kennedy, Doctor of Nursing Practice, registered nurse, and ANCC certified nurse informaticist, as well as HIMSS certified professional in healthcare information and management systems, brings over 10 years of experience in informatics and clinical trials. As a nurse informaticist, Dr. Kennedy specializes in healthcare informatics, merging clinical trial expertise with technology to enhance patient care and healthcare outcomes. So thank you all so much for joining us tonight. And with that, we're excited and grateful to learn from you. I'll now hand it over.
Thank you very much. I was going to ask Dr. Kennedy if she could advance the slide to slide 4. Thank you. All right, good evening, and thank you everyone for being here. I'm Dr. Katie Kerr. Tonight we're going to introduce you to the HIMSS organization and all the resources that are available to you to explore the field of health information technology and management and the many careers and opportunities that exist for all of you. So I'll start by talking just a little bit about what the HIMSS organization is. HIMSS stands for the Healthcare Information and Management Systems Society, and HIMSS is a professional association for people who work with information technology and healthcare. You can think of HIMSS as a really big network that connects different groups of people who are all interested in improving healthcare through information technology. So they bring together healthcare professionals, IT vendors, government agencies, universities, and many other organizations and people from all over the world. And so HIMSS organizes events like conferences and webinars, and they have a wonderful website, which we're going to introduce you all to tonight, that allows people and its members to connect and access resources, through look at research, studies, check out best practices, and then we'll follow up with some information on certifications as well tonight. And so you can find all that information through the HIMSS website. But basically everything that a health information technology professional would need to stay up to date on the latest news in health information technology, you can get through HIMSS. HIMSS has different membership levels. Currently, there are over 125,000 members of HIMSS. These are all members that have either chosen to join as a regular individual member or are student members. So with a regular membership, members get special member pricing to attend the HIMSS Global Health Conferences, webinars, and other events. Members can also participate in online HIMSS communities, committees, roundtables. I'm going to touch on a little bit of that before I pass it along tonight, but you can also join local HIMSS chapters, and these can be a chapter of your choice. A lot of our states in the United States, and then also globally, there are local chapters, you know, located throughout the world that members can join. So you can have more of a close-knit feel with your membership. But we're also really happy to say that we now have a student membership level that includes high school students. So the student membership is focused on emerging healthcare leaders. Students get all of the same benefits of regular membership, but at a lower cost. And the only requirement for being a student member is that you do not hold a full-time position in healthcare information and management systems, and you also need to be enrolled in high school or an academic program in higher education. We can go on to the next slide. There we go. So as a HIMSS member, you can join one or multiple HIMSS communities. So on this slide is a list of HIMSS communities that members can join. These are ways for members to network and problem solve and learn alongside like-minded people from, again, around the world. So some communities are geographic in nature, such as the French community. Some are role related, such as the nursing informatics community. And some are just groups of individuals with common areas of interest and focus, such as like the telehealth community. So these would be just a really great place to connect with professionals working in the field. We can go on to the next slide. But the one community I really wanted to highlight as a segue into this presentation tonight is the community of emerging healthcare leaders. So I think that this would be of special interest to HOSA members and advisors. This community offers support for anybody, early on in their career or looking to enter the health information technology field. So this community offers bi-monthly webinars. We have a Day in the Life series, which we can talk a little bit more about later. But this allows you to explore different careers through interviews with professionals who are working in those roles, as well as just different tools and resources and guidance that you may need to become part of the next generation of information and technology professionals. So there are also monthly newsletters that, of course, share all the great resources and bring those to your attention as well. And next slide. So the next thing here, and lastly, how I want to wrap things up before I turn it over, is I just wanted to talk a little about the HIMSS task force. Task forces are just a group of HIMSS members that work together with other health and technology experts to focus on specific topics. In these groups, professionals share ideas, discuss problems, and just find solutions that make a difference in the area that they're focused on. So I currently lead the Emerging Healthcare Leaders Task Force, and all the members tonight are part of this, or sorry, all the speakers tonight are members of this task force. We have 8 volunteer members, and we work on creating content and activities like tonight's webinar. So we focus on just helping all HIMSS members and emerging healthcare professionals grow. We're always looking for ways to improve programs and building resources and creating opportunities for students and new healthcare professionals. So with that, I'm going to turn things over to Dr. Christina Eldridge, who's going to talk a little bit about the HIMSS professional certifications.
Oh, thanks, Katie.
Yep.
So one of the biggest questions I get from undergraduate students, because I teach undergraduate students right now, is, what certifications can I qualify for if I'm interested in this field? Well, the interesting thing about HIMSS is that you can qualify for certifications even with a high school diploma. So it's a very, I guess, inclusive type of organization, which is what I like the most about it, where you can learn from other people. And for the particular type of certification that a high school student or undergraduate student would probably the most qualified for would be the HIMSS certification, which stands for the Certified Associate in Healthcare Information and Management Systems, or HIMSS. There is another certification, but that certification is more directed towards graduate or I guess professionals with a lot more extensive experience. So I recommend this certification as something that you can look to if you're just graduating from high school or in the undergraduate environment. And why would you want to do a certificate like this? Well, a lot of times the students are coming in and they want to do internships and they want to move on to a career, but what you really need is either experience or some sort of demonstration of your expertise. And so you can kind of get both with this certification because you have to do some hours to qualify, and then also you're going to go through the process to get the certification, and it increases your credibility to employers. Next slide. And the one thing I think I didn't put on that previous slide was that it also can increase your your earning potential. So that's a good thing. And the process for certification is you go through an application process to, meet a couple of, points that you need to fulfill, some qualifications, and then you go on to a preparation stage if you are accepted to move on. And the preparation stage would involve studying primarily for the exam and doing review exam questions and going through, review books, and then eventually you take your exam. Next slide. So to qualify, or eligibility for HIMSS would be at least a high school diploma and 45 hours of continuing education in digital health or informatics or the health IT environment, or 150 hours of experience. And to explain this a little better, I have a student who is applying for HIMSS and didn't really have 45 hours of continuing education in health IT, but did work in his dad's healthcare setting, which was doctor's office, and he worked with the electronic health record system there. So that qualified him for to be eligible to take the exam. And if you have more than a high school diploma, like you hold an associate's degree or a bachelor's degree, then you can qualify with 25 hours of continuing education or 75 hours of experience. Next slide. And you're probably thinking, okay, well, what qualifies as experience? Well, it can be any type of health IT role. It would just be some sort of information technology use, or observation in a healthcare setting. And could be volunteer shadowing experiences, practicums, internships that maybe are available either through your high school or your college or your community college. And it could, again, it could be work. You could be working maybe in a healthcare setting and using electronic health records that would qualify. Next slide. And there are for continuing education hours, they're measured in hours. There are free options through HIMSS, and you can go to the website. They have a resource hub and a resource center, and there's some on-demand webinars there. There's several free options, and there are some that require you to pay for them. And as far as college coursework goes, I know that some of the students go on by just completing coursework in the health IT area, and one course credit will equal 5 hours of continuing education. So in other words, if you're taking a 3-credit class and you multiply that times 5 CE hours, then that would be 15 hours. And as you can see, those really kind of accumulate rather quickly. And if you're doing dual enrollment through high school, some of your coursework might have qualified. It just depends on what courses you're taking. And I would contact HIMSS directly, to ask questions on those. Next slide. And so the exam topics, I took this directly from the CA HIMSS candidate handbook, which is available on the website for free, is that the majority of the topics are actually just in the general healthcare information and systems management. There is some leadership questions, some clinical informatics questions, that's about a quarter of it. And then healthcare and technology environment is about another quarter. So those are the topics that are on there. And if you look at the handbook, you'll be able to see the subtopics under there. Next slide. And so I just listed a few resources that would help you think if you were going to prepare for the exam. One would be that handbook on the previous slide. There's a practice exam that you can purchase on the CA HIMSS website. And then this review book that you see the screenshot for here is the official review book for this particular certification. And then I think, Katie, who's next? I didn't see.
I think Dr. Pelkey and
Yep, that would be
Courtney.
me.
Yeah.
I'll take it over from here.
Sorry.
Please excuse the cold. I'm going to talk about a few really excellent resources from what is called the HIMSS Resource Center. The two areas that I'm going to focus on are the technology, health information and technology job descriptions, and then also career pathway. But before I move on, I'm going to actually jump into a little bit of a demonstration. But just to clarify, it's you don't have to know what you want to do. This is a really, really great resource so that you can look through different types of job positions that go into detail on what they do, what education is expected, and you can learn things on like maybe what you don't know. Like, this really sounds like something I'm interested in. I didn't know this job existed. But just going through it gives you some sort of ideas of what kind of career fields are within the health information and technology field. So it's really great. And if you do know, then it kind of takes you a step further. So if we can go on the next slide, please. The next step is really going through the career pathways tool. So looking at it from a couple different perspectives, maybe you've identified a job that you're really interested in, and you can say, okay, well, that's my short-term goal, but my long-term goal is something higher up within the field. And so this helps you navigate that, or you can kind of work it backwards, saying, I know this is what I want to do. What are the steps that do I need to take to get there? And so HIMSS developed this pathway tool. It helps you explore these different roles. And so I'm going to go ahead and see if I can share, Courtney, and go right ahead into the demo. There we go. All right, please let me know if you're not able to see my screen. So here's what the Resource Center looks like. And from this point, I'm going to go directly into, we talked about the health information technology job descriptions. So here is the job description component. And what you can see is it lists out all of these different types of jobs that fall within the health information and technology field. What I'm going to do is, I was always interested in application analyst as an entry-level job. So I'm going to go ahead and I'm going to find that on page 9. Okay, and so here it tells me what this role is responsible for, what are the primary responsibilities, and what are the qualifications. And this is really important because you can then set up some of your goals in terms of, well, I know I need a bachelor's degree, and it looks like I need 2 years relevant experience. Maybe I can do that while I'm obtaining my bachelor's degree. If you want to work at a local healthcare institution, work with your educational institution to help you set that up. But really important to understand, if this is the direction I want to go, this is what I need to know how to achieve those goals. And so Katie had also talked about having conversations recorded of people within those positions. Some of these positions have these hyperlinks where you can actually hear a conversation of somebody in that role. They talk about how they got to that position, what it consists of. So you really get a firsthand feel of what they do. And it just personalizes it in terms of listening to someone who's really in that field. And so going back to the resource center itself, the next step is the career pathways. And so you can see that there are levels of progression in terms of how they're divided out. And so entry, mid-level, advanced level, and expert level. And all of these are really important to look at in terms of maybe short-term goals and long-term goals. So what I'm going to do is I'm going to go ahead and if you go ahead and you click this and start your journey, you get into, this is what it pulls up and it brings up in terms of the pathways, and you can look at these and, oh, here I found this in the job descriptions that really intrigued me. I want to select that and see maybe what options that I have. So here, when I go into the application analyst role, you can see it has a link to find jobs, and Courtney's going to go into this area a little bit more detail. I'm going to stick to the pathways here. And again, it kind of reiterates what the responsibility is for this role and the qualifications. So again, I'm looking at, okay, here's what is required of me to get this. And oh, I see proficient in Microsoft Office. I can start working on that. Well, maybe I'm looking for where I want to get this education from. So always thinking about using this as a tool in many different perspectives. And let's say I've achieved my goal, my entry-level goal in application analyst, and I've been given a couple different projects and I've fallen in love. That's my passion. That's what I want to do. I want to be a project manager. So that is maybe something you look at in terms of, next steps. So in terms of now looking at it kind of in the terms of a mid-manager, we're looking at, okay, what responsibilities are different and what qualifications. I also wanted to mention here that you can see the hyperlink to actually somebody within the field who's also talking about being in this role. So another great resource. But here I can see a master's degree is preferred. So, okay, I know I'm going to have to level up with my education in order to level up with my career. So this is now my long-term goal is to achieve my master's degree. And I'm looking at the years of experience. Well, I know I haven't achieved that yet. So this gives me time to focus on some of the other elements that might give me a leg up when I'm pursuing this role. I can go ahead and pursue professional certifications, such as my PMP, so project management professional certification, Agile or Scrum. And so those are typically non-credit, non-educational kind of professional certificate elements. So you can pursue those while you're then researching maybe where you would like to go to obtain your master's degree, and always remembering where you're working, that they can sometimes help support that continued education. So always look at your resources internally as well. And I look at, I've put in my years of service, I've been here, maybe this is kind of where I want to, end up. And again, you can find jobs in the field. You can listen to somebody who's in a higher level role. And then looking at, okay, I can achieve this with what I've done in putting the years of experience. But also at this point, maybe there's, something I've never thought of doing and I've been exposed to it now. And it just shows you different pathways. Maybe from the point that we came from, maybe it was the data security analyst. So maybe I want to go back to the entry level and try the mid. But this allows you to look at it from both directions, how you move up and looking at those upper level positions and going backwards on how you obtain those goals along that track. And so at this point, I'm going to go ahead and turn it over to Courtney to talk about how you find roles within some of these positions.
Thank you so much. I'm going to go ahead and pull up our presentation here once more. Thank you for that. So my slides are not advancing. There they go. One of the things that Brooke highlighted was looking at the Resource Center. And HIMSS has a number of resources available in addition to career planning. One of those is the HIMSS Job Mind. That is a valuable resource for any healthcare professional if they are seeking new opportunities. As we go through this presentation, we're going to look at how to navigate what the HIMSS Job Mind is and how it can help you in your professional and academic goals. Another key element is that it helps you to research companies. If you're wanting to go into any sort of healthcare informatics, and that is really your passion, you're going to want to make sure that you have a good understanding of how a specific company or organization feels about their data, their culture, how these things kind of fit together. So for the next slide, how you navigate the Job Mind is the Job Mind platform allows users to search for jobs. You can also look for things based on specific keywords, job titles, and also some locations. Filtering results can get you also criteria and looking at what kind of skills you have currently or those that you're looking to develop. One of the other exciting things is you're able to save job postings. So if there is a job or a company that comes available and you're looking specifically for a role at an organization that has that job, you can save a job or you can look for other jobs frequently that are very similar. So with that, I'm going to go ahead and stop the presentation. And we are going to look at the HIMSS Job Mind. So I'm going to slide this over. Just make sure, is everyone able to see the, the web page?
Yes.
Okay, thank you so much. All right, so you are able to access the HIMSS Job Mind by the main website. That is also, the website is jobmind.himss.org. And this is available to anyone who is looking for information about jobs that are currently available. So I'm going to go ahead and we can see here that there's a list of featured healthcare IT jobs. And as Brooke mentioned, there's also the career planning portal. So you're going to find that the career planning portal and the Job Mind really are going to work hand in hand. The things that you're learning with the career ladders and looking for jobs to apply to, you're going to be able to use those skills in the Job Mind as well. So these are two different tools that combined together are very beneficial to you as you are looking for other organizations or jobs in particular. One of the other things is if you go down, you're also able to browse by category. So if you have a general idea of about what you are looking for, you're able to click on a specific job function, or you can look at different states. One of the things that I really like about this is it also has a section for remote work. So we're going to go ahead and I'm going to look at just specifically job function, and I'm going to look at the clinical documentation improvement. Clinical documentation is used across all different healthcare roles, and the integrity and the ability of our other healthcare professionals to document the care patients are receiving is very important work. So I'm going to go ahead because that is one of the things that I would be interested in looking at. And I click on that link. And here we have one job come right away. So it tells me that this is a second level RN review. If you notice, it also gives me the median salary as well as some of the cost of living information. So I currently live in the Midwest. I would be interested to know if that's equivalent to where Texas is. So I can look here and see that the minimum experience needed is 3 to 5 years. The minimum education, that salary range, and it also gives me a good description of what that job entails. You can apply directly through there, and it gives also the list of skills that are necessary for this job. I'm going to go ahead and go back, and I can look as well at clinical information management. If I click on that link, I can see that there is an opportunity for the Agency for Healthcare Research and Quality, and it is physicians, clinicians, researchers, and also digital health researchers. Again, it tells me all of the similar information, so I'm able to compare those back and forth. One of the other things that we can look at is information technology. So if I click on the information technology, I'm shown two results here. One of them is about the revenue cycle. This is a spotlight as well as a preferred job. It gives me the information and also a job summary as well. I'm going to go ahead and flip back to our PowerPoint. Okay. Is the PowerPoint showing now?
Yes.
Thank you so much. So you are able to also make job alerts. The first time that you go to log on to the job line, it will ask you if you want to set up an alert. You can put different filters and items on there, such as keywords or location. You can also look at certifications that required, job function, or job type. The job mine is such a wonderful resource that is available to anyone as you're planning what you want your career to look like. You really start to get a sense of what's available and what are the requirements or qualifications. So having a filter and setting up alerts is a wonderful tool. Also, with the job mine, it is going to identify areas for growth. As we've seen a lot of changes where a lot of software applications are now very cloud-based, you can look and see, are there requirements to have different certifications in a new field? So another one is the radiology informatics or the imaging systems. And would you be able to match something like that if you were interested in it? So you're always going to find areas for growth based on what a job description says that they're looking for. Additionally, that you can look at additional education or certifications that maybe are required for jobs, and that will help you along with the career planning to really build that portfolio and make you a desirable candidate for lots of different positions. It can also help you seek some mentorship opportunities. You're going to be able to expand your network and gain valuable insights in your industry. So in conclusion, the HIMSS Job Mine is a very valuable resource, and it's for anyone who's looking to advance their career. Understanding that job search process really helps you to look at those different opportunities. By focusing on your professional development, you're able to stand out to employers and find your dream job. So I'm going to go ahead and we'll pull it over to the last slide for questions.
I have a question. What was something maybe unexpected that future health professionals can be aware of that you learned when you first started working in health IT and health informatics?
Courtney, Brooke, do you?
I think just how broad the field is, and you really don't want to pinpoint yourself into to be stuck in a box or one direction. Be really open to learn as much as you can, and some of the resources that we showed really identify that, you know, in addition to traditional education, there's so much value in professional certifications and credentials. And so those can be, you know, pursued at any time or in conjunction with And you might really fall in love with something you never even knew existed or thought you would like. So really just kind of be open-minded. And that, again, it's so much broader than maybe what the term sounds like in terms of the career field.
Yep.
I agree with that. I think it's one of the reasons that you have to really understand what it is that your passion is. For example, an application analyst at one location might be responsible for developing workflows, and they really do a lot of end user questions, trying to make sure that the system is supporting everything and that we're looking at it from an informatics standpoint. We're at a different organization. You might not be doing workflow analysis. You might be really focused on project management. So I think I will just echo what Brooke said about it is very, very diverse, even within the same organization, what those different skills and specializations can be. So it's an exciting field in that you really get to follow what your passion is.
And I'll remind our participants, we do have a Q&A function should be on the bottom right of your screen. You're able to put questions in there, and we can answer those live in the chat, excuse me. Couple more questions for y'all that I was interested in. How does the health informatics profession maybe help other health professionals, and how does it fit into the broader picture of healthcare?
Well, the whole foundation of information in healthcare is now based on technology, whether that's on the clinical side with the electronic health record or on the business side. There are some rules and regulations now where everything has to be submitted a certain way, and it's all by technology. And so, when you're in this field, again, how I said there's the clinical side and kind of the business side, you can actually specialize in one of those sides. So when Courtney talked about I don't want to go, application analyst is just one single example, but you can be an analyst, a clinical analyst, or you can be a revenue cycle analyst. And so those skill sets really transgress across the entire health realm. Like you're the way that you're working with clinicians, or the way that you're working with so maybe somebody in compliance, you're setting them up to be successful in terms of how to utilize that technology, how to analyze that information that's coming from that technology. And the whole goal is on improvement and better outcomes. And so really, I'm not sure where you're not connecting in some way, or helping in some way. It is really an amazing field.
Thanks, Brooke. So we have a couple questions here. The first is, what is the difference between HIMSS and a HEMA? I can maybe just start a little bit on that question. I can tell you that I know Dr. Pelkey and I are both members of AHIMA and HIMSS. We both hold credentials from AHIMA. We are both registered health information administrators. We earned a 4-year degree in health information management. And then Dr. Pelkey, you can maybe speak a little bit. You have the CP HIMSS credential from HIMSS. HIMSS, I would say, is a little bit more technology focused, and AHIMA is, I would say there's technology. I feel like there's technology involved with everything in healthcare these days, but Health Information, American Health Information Management Association is definitely focused on the management of data, healthcare data, and of course, there's many avenues that come with that, from coding, quality, compliance, risk management, the management of electronic health record and documentation, and those things. Dr. Pelkey, do you want to add anything to that?
No, I really agree with you. There is some crossover when you thinking about interoperability in certain components of how we utilize the technology. But I think you explained it very well in terms of, the focus of maybe administration and leadership, of data, of information inflow, outflow, data governance, maybe, at the HEMA, where HIMSS is a little bit more technical, and also kind of focuses a little bit more on the analytics of that data.
Yep. Let's see, next question. What are the ways high school students can introduce themselves in this career field, and what can we do to learn and prepare? Dr. Kennedy, do you have thoughts on that?
Yes, absolutely. I think having an interest as a high school student and preparing for this field is just an awesome thing to even discuss. I think I would start with looking for organizations in your area that are open to job shadowing. So every organization is going to have a different policy on what areas you can job shadow, if there's mentorship available, but looking at what are the job shadow opportunities, or even like a preceptorship with an organization that has like a medical or a health record. So a lot of the organizations have health records, which means that there is someone from an information technology standpoint that supports the work that is being done and the care that's being done for patients. So looking for opportunities, I think, to reach out to organizations locally to you would be a really good first step.
And HOSA also has a health informatics competitive event. Just wanted to plug that as well. So if you're interested in getting introduced to the field, that's a testing event for both the secondary and post-secondary collegiate division. And it's a really popular event. I actually did it myself when I was in high school and learned so much about health informatics, electronic medical records. Would highly recommend that.
Thank you, Nicholas. Maybe one more question here. And then for those of you that we have not answered questions, we're going to do our very best to follow up with an email afterwards to provide additional information. So the last question here is, can HIMSS help with high schoolers looking for schools right for them after finding what they're passionate about? And so right away with that question, I was thinking about the HIMSS approved education partners program. So it's the AEP. If you go to the HIMSS website and you type in AEP, you should be able to find all of the HIMSS approved education partners. So basically, I these are programs that have been vetted through HIMSS to be their partners in offering health informatics and information technology programs to, so if you find the area you're really interested in, definitely check out the AEP colleges and universities to see if they offer the program that might be a good fit for you. So with that, I am going to have Courtney advance the slide again. Thank you, Courtney. And I just wanted to put a plug in for a couple free webinars that are coming up that might be of interest to all of you. So first of all, next Tuesday, I'm presenting alongside Mara Diker, the Exploring HIMSS Workforce Resources webinar. So we'll be taking an even deeper dive than we went tonight into all of the resources offered through HIMSS. And we'll be sharing a variety of career and workforce development resources and tools and opportunities that HIMSS offers. So talking a little bit more about all of these things we just touched on tonight. It'll be recorded and you can also watch it on demand. But that, again, that is a free webinar for anybody. And then on Tuesday, December 10th, we have the webinar From Classroom to Workplace, Equipping Professionals with Informatics Expertise. So this webinar, you'll learn how graduates of health informatics and technology programs use the skills they learn in the classroom to transition into the real world. So that definitely goes along with some of the questions we've been getting this evening. And so they'll be exploring the demand for, specialized technical skills in the field of health informatics and many other things. So definitely check those out. You can go to hims.org/events to see those and register for them. And then on the next slide, we do have a few email addresses where you can contact us. And I think with that, I will just thank everybody for joining us tonight. We were just really happy to be here with you and share a little bit about HIMSS and about health information technology and management professions and the career. So thank you.
And thank you all for hosting tonight's webinar, sharing your
Mhm.
knowledge and all of the resources. Thank you so much.
Thank you.